varicose striae include endothelial damage, stasis, and hyperviscosity. If patient has any of these risk factors, he can be predisposed to thrombosis, especially the deep vein thrombosis. So we'll go through each one of them. So endothelial damage, it can be caused by local vessel inflammation. In case of deep vein thrombosis, it's mostly the varicose veins or superficial thrombophlebitis or graft thrombosis. Superficial thrombophlebitis, it can occur in patients with varicose veins with a blunt trauma to the veins. And second risk factor is stasis. Stasis can be caused. Stasis means if a patient is on prolonged bed rest. For example, patient who has stroke or any recent surgery, particularly orthopedic surgery, and he has compressions applied to his limbs. And in case of CHF, because in CHF heart is not able to pump blood, so blood is it is pooled in the vessels, so it can predispose to DVT. And the third risk factor is hyperviscosity. Hyperviscosity, it can be due to in pregnancy or patients who are taking oral contraceptive pills, or in thrombophilias, protein C and S deficiency, and in cancer is a hypercoagulable state, and in polycythemia vera, where bone marrow produces excess number of RBCs. So now we will go through history and physical examination, which is quite interesting. So in history we will first assess ask patient about the risk factors, and then we will ask about the symptoms. And symptom is usually acute and severe pain in one of the limbs. In DVT, it's mostly a unilateral cause of leg swelling. If a swelling is unilateral, you must rule out DVT. And if patient develop pulmonary embolism due to DVT, he may have symptoms such as pleuritic chest pain with dyspnea, hemoptysis, and collapse. And how pulmonary embolism develops, I will show you here. So the deep veins of legs, embolus, it travels from the deep veins to the inferior vena cava, and through inferior vena cava it goes to heart, and then from heart through the pulmonary artery, it lodges into the pulmonary artery, and this is called pulmonary embolism. Remember that deep vein thrombosis, it develops in the vein, but pulmonary embolism is in the artery, so it can infarct a big portion of lungs. It's a kind of medical and surgical emergency. So what are the signs and symptoms? I